Welcome back. This is part 2, dealing with psychosomatics. We all have a reservoir of this dangerous tension which we need to discharge in a healthful way, not through psychosis or as an attack on our own body. Dr. Brody was very clear about the negative outcome of treatment if you did not address the crucial area of early inability to have access to discharge of this dangerous built-up tension. If you, during a psychoanalytic treatment, leave out this early flaw, namely the malfunction of discharge, you can have all the explanation, understanding, and interpretation. If this early dysfunction is kept safely underground, the patient is not getting the adequate treatment. Brody was practicing modern psychoanalysis, a treatment method developed since the mid-40s in order to solve the most early dysfunctions. Dr. Hyman Spotnitz, MD, and Doctor of Medical Science originated this method. The classical method of psychoanalysis was discarded, as Spotnitz meant that it could not help patients to resolve their nuclear problems. In modern psychoanalysis, emotional, symbolic, and indirect interventions have replaced the classical methods of psychoanalysis. Dr. Spotnitz was a research psychiatrist, a pioneer in group psychotherapy, as well as originator of modern psychoanalysis. Dr. Brody was thus conducting treatment of the psychosomatic patients according to the principles of modern psychoanalysis, and he said that if we want to treat these patients effectively, that is, the people suffering from psychosomatic disorders, we need to reorganize their mind and brain so that they can healthfully discharge mainly their negative emotions. If our brain circuits, our neurons, are going one way all the time, we need to deactivate these circuits. We want our brain neurons to do something different. We are searching for the psychomatics of a cure. This is a quote from his lecture. I continue. Another important contribution to the treatment of our very earliest mental damages is the anaclitic countertransference. Dr. Spotnitz used this term to describe a positive relationship in the transference where the analyst is able to feel the feelings that the patient needed in order to develop and mature in a healthful way, feelings which they never received. The analyst can provide these feelings to the patient through verbal emotional communications. And I may add there also that they can be communicated by the unconscious, a direct link between the unconscious of the therapist and the unconscious of the patient. This has also been called maturational interpretation. Excuse me. During my education in Philadelphia, I attended for 6 years a training group in New York City led by Dr. Spotnitz. It was in this group I first heard him talk about the analytic countertransference. I am including it in this presentation as it is a considerable curative agent and deals with the most early experiences of mental development. The analytic countertransference was, of course, well known to Dr. Brody. The discharge excitation theory and the theory about analytic countertransference are, in my opinion, two of the most important curative agents. Brody speaks about the importance of listening to the feeling, listening to the tone of the patient. The patient can scream in anger. You hear the scream, the noise is there, but not the feeling. In connection with this, he addresses the concept of alexithymia, another tongue twister. The inability to express feelings with words, that is what it means. He means that this inability to, in an integrated and pervasive way, put words on our feelings is a dysfunction that all persons suffer from, especially when it comes to our deeply rooted, very early emotions. Alexithymia exists both in the analyst and in the patient. Peter Sifnios, a medical doctor and psychiatrist, has been credited with creating this term in 1972 from the Greek words lek, which means lack, lexis, which means word, and thymos, which means emotions. I am now ending this part 2 of the presentation. Please continue to part number 3 to hear the rest of the presentation.